Perfect. Thanks, Jeremiah. I appreciate that. Again, good afternoon, everyone. My name is Kimberly Clay. I'm the Senior Account Manager at Health Alliance Plan. And as Jeremiah mentioned, I have Nicole McAllister on the call today. She and I both work to support the City of Detroit account. I want to thank you all too for taking out some time this afternoon to attend today's presentation and to learn more about HAP. And I'd also like to take a moment to thank Jeremiah and his team for setting up today's call. So let's get started. Okay, yep, great. I always like to begin my presentations with a brief overview on HAP. HAP has been a trusted healthcare partner for over 60 years in the healthcare industry. HAP was founded by then President of the UAW, Walter Reuther, in 1960. We are an integrated healthcare system owned by Henry Ford Health. This partnership gives HAP a clear advantage in that it allows HAP as the health plan to collaborate with a health system to come up with innovative programs for our members as well as the community we serve. We have well over 400,000 members enrolled, and HAP is committed to your health with exceptional coverage and member benefits. HAP is Michigan's home for health insurance. So as you can see on this slide, HAP has a very strong regional presence in the Michigan market, and we are affiliated with the leading hospital systems in the area. I mentioned Henry Ford's health system, and we are owned by them. And you may have heard a lot about Henry Ford Health in the news recently, as there was a joint venture merger with Ascension Southeast Michigan providers. So we're happy to have them on board. And Ascension also has additional providers that are within the state of Michigan that are also part of HAP's network, but not necessarily under the Henry Ford umbrella, but they are still, again, with HAP. We have Corewell Health, which is the Beaumont system, also affiliated with us. DMC Hospitals, which is the Harper, Receiving, Sinai, Grace, etc. U of M, just to name a few. As a City of Detroit HMO provider network. So that's our entire network under our HMO plan. Under this program, there's no out-of-network coverage except for urgent and emergent care. We have over 9,000 primary care physicians or PCPs and 21,000 specialists. Selection of a primary care physician or PCP is required under this plan, and it's also really a good thing to have a partnership with a primary care doctor, someone who is well knowledgeable of your overall health status. There are no specialty referrals that are needed under this plan, and I'll talk a little bit more about that. And then if you want to know if your doctor participates in the plan, go to hap.org under /find a doctor, and you're able to look up your doctor or your hospital system in our network. So let's talk a little bit about prior authorizations and referrals. And again, I mentioned that no referrals are required to see a specialist. However, some specialists may ask that you obtain a referral. Specialty practices can be busy, and therefore the specialist may ask that you obtain a referral from your PCP. Some specialists may only accept patients whose primary care physician believes the patient needs specialty care. And I recently saw something on the news where some of these practices are several months out. So again, if the specialist asks for the referral, it's probably just to make sure it's appropriate for the visit. And now prior authorizations are a little bit different, but those are required for certain services and or procedures. Your provider will request your prior authorization or PA on your behalf. An example of some services that would require a prior authorization would be surgeries, MRIs or high-tech imaging, some inpatient hospital stays, and some medications. And this is very common, a very common practice in the medical field to get a prior authorization for these services. So let's talk about understanding cost share. These are probably terms that you've heard before, but I always feel like it's really important just to give a refresher. And the first thing I'd like to talk about is the deductibles. Most plans today do have a deductible on their plans, and the deductible is the amount that you and or your family may owe before the plan begins to pay. The copay is the set amount that you pay each time for the services when you have an office visit or your medical medications or medical supplies. And of course, copays can vary. Coinsurance is the percentage of the allowed amounts that you pay for certain services after your deductible has been met. And your out-of-pocket maximum is the total amount that you and or your family will pay uh, in a given benefit period before the plan being HAP will pay 100%. And I always like to point out too that this came about with Obamacare, as most people know it as, or the ACA, Affordable Care Act. And once upon a time, the plans did not have an out-of-pocket limit or maximum, so you would just continue to pay, and then each year it would start all over again. But under the ACA, they put in a maximum that you and your family will, once you hit that amount, then you will no longer pay. The plan will pay 100%. And all of these cost share, the deductible, the copay, and the coinsurance out-of-pocket maximum are all listed on your benefit summary. So what's new for 2025 for the City of Detroit employees? And this is actually a benefit that's across all of our commercial plans for 2025. Governor Whitmer actually signed into law that they changed the age limit for autism spectrum disorder services for your children or any of you that may have children that are autistic. So at present, the age limit was 18, and then you could not cover that child anymore for those services. But again, Governor Whitmer signed into law that this coverage will extend beyond the age of 18. So if this is applicable to any of you out there, this is definitely an additional benefit that we're happy to announce we're covering now, or will be for 2025. So let's dive into what your plan design looks like. And so I'd like to start with kudos to the City of Detroit team because there are no changes from 2024 to 2025. I'm seeing a lot of people increase their copays and deductibles for employer groups. And so it's good to announce to you guys that the City of Detroit is not increasing any of the copays and so forth. So if you're currently enrolled with HAP, you will see that your deductible will remain at $750 for an individual, $1,500 for a family deductible. The coinsurance is 20%. Again, I just talked about what coinsurance means, and you'll see that on the benefit summary as to what services have a coinsurance amount. The coinsurance maximum for an individual is $1,500 and 45 for a family, which means that once you hit, if you're an individual and you hit that $1,500, then you no longer pay 20% towards those services that have coinsurance. And the out-of-pocket maximum or limit for the individual is 6,350 and then 12,700 for a family. And again, once you hit these amounts in a calendar year, you no longer pay anything to copays or otherwise towards your services. HAP picks up all of your coverage at 100% until January 1 when the coverage restarts again. The copays for your plan for preventative services are covered. That's another part of the rules from the ACA that came about. So when you go in for your yearly physicals, those services are covered at 100%. No cost to you. The primary care physician visit and your specialty visits are $25. Telehealth visits are 25 as well, and I'll dive a little bit deeper into that. And the emergency room copay is $100 per visit. That is waived if you are admitted. And urgent care services require a $25 copay as well per visit. On the prescription drugs, I won't get into each drug class here, but on the screen, as you can see, it's $10 for generic, which is pretty common. And then you see the list of those copays for all the different tiers. Mail order is also available through Pharmacy Advantage, and that's for a 90-day supply. So for those of you that may be on a maintenance drug, such as like blood pressure medications, cholesterol, and so forth, you can obtain those prescriptions through the mail, and it's generally at a two times the copay. So there's some cost savings and some convenience to go through mail order for those drugs that you take on a routine basis. The Save On program offers copay assistance only on select specialty drugs. So if you are on one of those drugs, HAP will reach out to you to offer the Save On program to you. If you're interested in learning more information on the drug program and what our formulary looks like, what's covered and what tier the particular drug will fall under, what your cost share will be, then you can go to hap.org/ prescription dash drug and put the name, first three letters of the name of the drug or the brand or generic, and it will pull up on our site to tell you exactly how that drug is covered under our formulary. I added this slide because this is something new, Henry Ford pharmacies, if you choose to use those. Of course, we're affiliated with all of the national chains, which are CVS, the Walmart, I used to say Rite Aid, but those are all closed now. And then I just saw something on the news that they're going to be closing some of the Walgreens facilities, but currently we are affiliated with those. Myers as well. And then again, some of the facilities have pharmacies on site, including Henry Ford. And so they offer curbside pickup. So if you don't want to actually go in or need to sit in your car for whatever reasons, they can bring that medication to you. They have some wonderful prices on some over-counter medications that you may need to get. And then there's more information with a phone number and a website that I can provide to your HR team should you need more information. And those include about 30 plus pharmacy locations. We also have services for patients with visually or reading impairments available in multiple languages. So again, if additional information or if this applies to you and or a member of your family, please let us know and we'll get some additional information to Jeremiah and team. Still, I always again like to include certain slides, and I think this one is an important one too. Telehealth, I talked a little bit about that previously, but telehealth allows for virtual visits for minor conditions like such as a cold or minor injuries. We use Amwell for these visits, and as mentioned previously, you will have a $25 copay for these services. And I'll talk just a little bit more about telehealth on the next slide. The urgent care is generally used when you feel as though your condition is not life-threatening, but you do need to see a provider. You do have a copay for these services, and you are covered for urgent care anywhere in the world. The PCP or primary care visits happen when you need routine care, such as a physical or follow-up care from a previous visit. Again, your PCP should be your healthcare partner. He or she should be familiar with your overall healthcare status, and your PCP copay of $25 would apply here. And the emergency visits or ER department should occur when you need immediate attention for your condition, or if you do not seek care, it could be life-threatening. So we encourage you to make that decision. If you feel you need to get in right away, by all means do so. You will have a copay for your ER visit. However, if you are admitted as a result of your emergency room visit, that copay will be waived. HAP members are covered for emergency care anywhere in the world, similar to urgent care visits. And that's the same in the state of Michigan. Let's just say you're up north somewhere, go to the closest emergency room, you're covered. We do have a slide, I'm sorry, we do have a flyer on this particular slide. So if anyone feels like it would be helpful to just have this handy, I can also get this over to the HR team. So one last little talk about telehealth services, and because I bring it up and talk a little bit more about it because a lot more people are using this service. It's becoming very common and it's very convenient when it's appropriate. So again, I mentioned that Amwell is HAP's telehealth vendor. The providers under Amwell are licensed and board certified doctors that are available 24/7 throughout the United States. So let's just say you're traveling, you're out of Michigan, and you need to have a virtual visit through Amwell, you can connect with them anywhere across the country. They also offer behavioral health services or mental health services should you need them with a licensed therapist and social workers. You do not need an appointment to have a visit with a telehealth provider. So at any point in time, again, 24/7, just dial them up for that call or actually use your tablet or your phone for that visit. And again, it's for like minor things such as the common cold, the flu, headaches, things like that. And you must pre-register with a credit card to have on file in order to use these services. And again, your $25 copay for telehealth services will apply. Assist America. So this is an added benefit that talks about our partnership with this vendor. And Assist America is a special benefit at no cost to our members to have assistance when traveling 100 miles outside of HAP's service area. You must pre-enroll in the plan prior to your departure, and you will need a login reference number, which is available on HAP's website. Some examples of how Assist America can help is maybe you're traveling and you lose your passport, you become ill, and you may be traveling with a minor child or your pet. They can help to bring a family member to get your child or to get the pet for you. They can also assist with lost luggage or if you've lost your medication. Again, it's a great resource to have available if you're traveling. And again, it's at no cost to you as a HAP member. Assist America also provides identity theft protection. So I know you've heard a lot of stories and may even have a family or friend who may be a victim to this. And again, no cost for our members to join, and they can monitor all three credit bureaus on your behalf and assist if you should become a victim of fraud or identity theft. This is happening quite a bit these days, so I urge our members to take advantage of the benefit. Again, no cost to you, and it protects you with all three bureaus. Those of you that may have students away at school, so you have dependents that are away in college and outside of our service area, we do make provisions for those students or dependents. They are covered while away for urgent and emergency care for non-emergency minor illnesses, allergy injections, and prescription drugs, just to name a few. Students should have routine care, physicals, surgeries, and so forth done when they come home for the summer, for vacation, or during the holidays. So we do know that there are some situations where students may have to have services that are considered routine, but they are not coming home at this point. And so we do have a students away at school coordinator that can help and assist, and that phone number is available on our website. So please reach out to them for any additional services that aren't emergency or urgent that your student or dependent may need while they're outside of our service area. This flyer is also available should you want to have it and or share with your dependent student away at school. So let's talk about what's available on HAP's website. For those of you that are current HAP members, I hope you're using HAP's website as a resource tool. For potential new members to HAP, I'd like to let you know that we have a very robust website. You can review your claims history, review your explanation of benefits, also known as an EOB, and this will allow you to see where you stand as it relates to your deductible and your out-of-pocket costs at any time during the benefit year. You can also order an ID card should you lose your card. You can review the pharmacy formulary, for copay amounts, review your benefits and coverage. And as a HAP member, you can also review discounts that are available to you, such as sporting events, gym memberships, running shoes, dream dinners, and things like that, just to name a few. All of our forms and documents are also on the website. And we also have a link to our health risk assessment, which is called iStrive. Should you want to go out and take the risk assessment, and it does give you some really helpful information back based on the information that you put in on how to live healthier lives, if you will. So I urge everyone to do that if you have an opportunity. Our healthcare cost estimator is also available on HAP's website, and this is a relatively new feature. It's been around for a few years now, and it's a great tool to have. And as people are and employees are becoming more conscious about their healthcare and the cost of healthcare, this tool is very helpful in giving you estimated prices on doctor visits and procedures up front to help you make a more informed decision on where to get care. Once you're logged in, your personal out-of-pocket cost for a treatment will display. So let's say, for example, you have a knee replacement coming up or a particular surgery like that. You can go online, put in knee replacement, and it'll give you the cost of all of the HAP affiliated providers and what that cost will be based on your actual plan design, so that again you can make a decision because you do have a deductible, you do have some coinsurance, and it allows you again to make an informed decision as to where you might want to receive that particular procedure. So again, another helpful resource that HAP provides to our HAP members. And then last but not least is our digital platforms. Again, we're all in a digital age where everything is at our fingertips and it's on our tablets, it's on our phones, and you can download your HAP app on your phone. You can also put the Amwell telehealth provider app on your phone, so that way if you do need to seek those services, you have those right at your fingertips with the telehealth. The Assist America, I talked a little bit about that. That app is available. Again, you'll be traveling when you use it, so you definitely want to download it before you leave on your trip or your vacation. And then the wellness tools that we have available through WebMD is also available for you to download. So I covered a lot of material today, so if I missed something or if you have questions after today's presentation, please feel free to reach out to customer service. The phone numbers are there on the screen and also available on our website for you to reach out personally by calling. Member services there Monday through Friday from 8 a.m. to 7 p.m. And you can also contact our member services department via hap.org, where you can put in your question, and I believe it's a 24-hour turnaround. Well, they will respond back to you via email. And just a reminder to the City of Detroit employees, open enrollment is October the 22nd until November the 6th. So with that, I want to thank you very much for taking out some time again today, and we'll take questions now. See, I'll go to.
Okay. I don't